The BrainSUITE is actually an integrated MRI within an operating room. So it's a traditional operating room with an MRI. And so that allows the patient to be scanned before the procedure under general anesthesia, undergo surgical resection of their tumor, and then after tumor resection, gauge your success or failure of your amount of your resection at the end.
I feel that we were very blessed to have encountered Dr. Cattorini. Our first encounter with him was in the emergency room on that Saturday night, the day that we found that Michelle had a brain tumor.
Several months ago, I was going in for an MRI on my pituitary gland. My endocrinologist was checking, I was having issues with hormones, and she wanted to have my pituitary gland checked before she put me on hormone medication. So I went in for the pituitary MRI, and the radiologist came back and told me that my pituitary gland was fine. However, there was a large mass on my brain.
In Michelle Coulter's case, this is the tumor. As we come down, all the white that you see is the tumor, and you can see it's substantially large. It's outgrown its blood supply, so it's slightly necrotic or dark in the center.
He explains everything to you as far as when I was diagnosed with a brain tumor. There was never a time that I was under the impression of, well, what's going to happen?
We treat the patient and not what they come in with films and diagnostic studies, taking their symptoms into consideration, and as we take their symptoms into consideration, look at their films, and inevitably come up with a diagnosis and treatment plan.
When it comes from tumor removal, the beauty of the BrainSUITE, it allows a direct approach for the tumor and direct approach for removal of the tumor. This is our postoperative scan, and again, starting from the vertex, you can tell all the white tumor that was there before is now gone, and there's no more enhancement. There's some residual enhancement, which is at the normal postoperative changes that you get at the surface of the covering of the brain.
I feel that God blessed me to put Dr. Cattorini in my life. I couldn't have expected or asked for a better neurosurgeon, and God sent me the best.